Hello, my name is Aubrey Beck, and I'll be doing the case study on the 54-year-old man with a headache. Here's my driver's license. I will also put a picture of it on my assignment when I upload it. Here's me next to it. Okay, so the case that I will be presenting is about the 54-year-old man with a headache. His past medical history is that he's otherwise pretty healthy. He bikes and does aerobic activity more than average and has good nutrition, a stable job, and does not seem to have an altered mental state as noted past. He has been taking Sumaptratin for migraines for the past 10 years, as that has been an issue. And the only relevant family history is that he had a first cousin neurologically with a glioblastoma and who passed away at the age of 24. His current presentation is that he has right temporal headaches, vertigo, tinnitus in his right ear, and imbalance. He has trouble maintaining his balance, and this has been progressively getting worse for the past few weeks. He's got no underlying diseases or problems in the cardiovascular, pulmonary, or gastrointestinal system, and then the audiologic test revealed that he has right ear hearing loss, and so it's like lower pure tone. And in the tinnitus handicap inventory score, he scored a 65, and that was grade a severe for that one. And an MRI revealed that he has a 2 centimeter mass in his auditory meatus that also kind of extends into the auditory canal. And I just wanted to touch on how age, race, and gender are really important to consider when you're doing medical history. Age is important because some pathologies are more pronounced in different populations. Like if you're older, you're more likely to get dementia than someone who's 5 years old, depending on stuff going on there. And then some diseases or cancers are more found in women than men, or more men than women. So men get prostate cancer, women do not. So that's really important to take into account gender. And then with race, some pathologies are more common in different races that we've seen. And so that's also important because when you're going through diagnoses and trying to figure out what's going on, when you take into account these factors, you might be able to get a better sense of what's going on. Next, I wanted to touch on some medical term analysis. So labyrinthitis is the labyrinth plus itis. And so that's inflammation of the membranous labyrinth in the ear. And so in a sentence, this would be like, okay, the patient did not have labyrinthitis of the left ear. So he didn't have inflammation of that membrane. And so the second word is paresthesias. So paresthesias is par plus esias. And so par means abnormal, and then esthesias means sensation. So this means that there's abnormal sensation. And so if I were to use paresthesias in a sentence, it would be like the patient did not have paresthesias in the right side of their face. And the last word is glioblastoma. Glioblastoma is glia plus the connecting O plus blastoma. So glia is glial cells in the brain, O is just connecting, and blastoma is tumor. So together this would be a tumor of the glial brain cells. And in a sentence, I would be like, the patient had a first cousin who died at the age of 24 from a glioblastoma. Next up is the medical abbreviation. So MRI would be first, magnetic resonance imaging. This is what the patient had to see that mass in the ear. BP would be blood pressure. The patient's vital signs were all normal, so blood pressure was normal for this patient. HEENT means head, ears, eyes, nose, throat. So for this patient, since they were having some ear trouble, they had a whole EENT evaluation. Next up, the differential diagnosis I wanted to offer out of the ones to pick from was acoustic neuroma. And so acoustic neuroma is a benign Schwann cell tumor that affects predominantly hearing, causing tinnitus and everything else this patient had going on. So hearing loss, headaches, vertigo, imbalance, and tinnitus are all cornerstone symptoms of acoustic neuroma and are symptoms that the patient presented. Therefore, it was the most likely diagnosis, and the source I had that I referenced is right below there in APA format. And out of all the diagnoses, this one fit the patient the best because it took into account that this develops in the ear and it doesn't protrude elsewhere, like the brain, the metastatic brain cancer, um, or the Meniere disease. So this was the best pick from all those diagnoses. Lastly, I wanted to touch on the significance of medical terminology. And so the question I answered was considering how accurate and precise language impacts patient safety, the clarity of medical documentation, the prevention of miscommunication or misunderstandings among healthcare members. My response to that is that accurate and precise language increases patient safety by creating a baseline of communication between all medical providers and personnel that is standardized. This significantly impacts the clarity of effective and thorough medical documentation and plays a major role in decreasing miscommunications. If all healthcare members are on the same page across the board, there's less risk to patients for mistreatment and improves the care received by patients. So altogether, medical terminology and being very, fluent in all of these words is essential for being able to provide good quality care to every patient that you treat, because your communication with the patient also depends on your communication with the medical team as a whole. All right, thank you so much. That's my presentation.